Hi, I'm Dr. Eric Janowitz, the founder and clinic director here at Synery Oviedo Chiropractic. Now, a lot of people ask me, what are the common injuries that we see from a car accident? Well, of course, the number one thing that we're going to see is typically neck issues, and it makes perfect sense just based upon the anatomy and based upon how a car accident works. Let's just, for ease of sake, look at one of the most common types of injuries, which is a rear-end collision. So let's suppose you're sitting in the car that's getting rear-ended, hit from behind. Well, you're stopped, a car hits you, the car then pushes your car forward. As it pushes your car forward, the car seat is pushing into you, which then your body is stationary, your head then is whipped back. That causes what's called a hyperextension injury. And then as the car slows down, then your head whips forward, causing a hyperflexion injury. And it's further worsened by the use of a shoulder harness. Again, important to wear a shoulder harness to prevent you from being ejected from the vehicle, but that shoulder harness is actually keeping your body here, your torso, while your head is going forward. So that can cause, obviously, a lot of neck injuries and issues to the joints, ligaments, discs, nerves, muscles in your neck. The nerves in your neck also send strength and energy towards your head, and that can also lead to a lot of headaches. So that's another common injury that we see. And speaking of the head, besides the neck being jerked forward, backwards and forward during a car accident, the skull is too, and then your brain is sitting inside there, getting pushed into the various walls in the internal cavity of the skull, which can lead to a mild traumatic brain injury or a concussion. So you might notice concussive type symptoms as well. There could be brain fog, there could be problems concentrating, focus, all these sort of things as well, sensitivity to light or sound. All those are possible. So that's working our way up. Of course, the mid-back can also be damaged through that type of a car injury as well. So that can cause mid-back pain. The muscles attach from the base of the skull, and they go to your mid-back, your trapezius muscle. That can pull on those areas as well as your spine, cause them to go out of alignment. So we can have mid-back issues. You can have chest issues from wearing the shoulder harness, from wearing the shoulder restraint. That can actually cause bruising or pressure or irritation to the ribs as well. The other damage that can occur as you work your way down is, of course, the lower back. Now, the lower back can get flattened. The lower back should have a curve just like your neck, and as the car seat comes into there, it's going to compress that area, and that can cause areas to the lower back and cause lower back pain. Besides the lower back, you can also get pain into the legs. That's a condition called sciatica. So you can have numbness, tingling, weakness, pain into the legs. Now let's look at the actual extremity joints as well. When you're holding, say, a steering wheel, you can develop wrist pain. You can develop hand pain. You can develop elbow pain from getting jammed. So if the car's, again, being pushed, that's going to compress into the body. So we've seen elements of wrist, elbow, shoulder pain. If your arms are extended, that can cause issues. The door can hit you from the side, and that can cause a shoulder problem or a hip problem. You can also get a hip problem from the center console. So those also can occur. Another one you got to think about is your feet either on the floorboard or on the gas or brake. And so, but that occurs when your foot's on the brake. That can cause a ankle or foot problem. It can cause a knee problem colliding into the underside of the dashboard. So you can have problems from all the way to your feet, all the way to your hands, all the way to your head in a simple car accident that takes only a second to occur but can cause a multitude of damage. Now, it's really important to make sure that you're seeing a doctor that is trained in understanding the biomechanics of your accident, to understand what sort of injuries you might have, to assess all of them, and to have a team approach where they can put everything together for you. So our practice here has been in Oviedo for almost 20 years and has served nearly 20,000 patients, with several thousands of them being auto accident cases. And through our experience, we're able to see the patterns and recognize these types of injuries and properly have a system, a comprehensive system to take care of it using chiropractic, physical therapy, muscle work, other advanced strategies like spinal decompression therapy, laser therapy, manual therapy. There's a number of things that can do because of so many types of injuries and the injuries within each tissue as well. In addition, you want to be with a doctor that has a network of other physicians in the area, other specialties like orthopedics or neurologists or neurosurgeons, and all working together as a team to help get you well. But the chiropractor really serves as a quarterback in helping you. So if unfortunately you've had a car accident, the first thing to know is, well, why am I having all these unusual symptoms? Make sure that you write them down. Make sure you find a chiropractor in your area. Search under Google chiropractor near me. Read the reviews about that practice and understand how that office does. Make sure that it's convenient for you so you can get regular care, and make sure that they have the experience and know-how to take care of these types of injuries. So I'm Dr. Eric Janowitz. Be safe on the roads.